Okay, so welcome to our podcast. This is a little bit different today because this podcast is a spin-off of our radio show. So what I'm doing that's different before, because I've interviewed you many times. Like, I'm fascinated by you. But I went and I asked my audience to come up with questions for you.
That's awesome.
On the radio and on my social media. And so I have a list of questions that the audience on my radio show has for you. But first, but before you do that, I just want to shoot the shit with you. Like, obviously, to me, you look like you leaned out.
Yep.
What's going on there? I'm not that you needed to lean out, but it's noticeable.
Yeah, I did. I focused on what everybody should be focused on is what you put in your mouth, diet, supplements, and just stop the eating past 7 p.m., man, because I noticed my sleep. There's nothing more important than sleep. I mean, the damn turtle lives forever because he sleeps a lot. And it's the truth. So elephants live a lot longer too. And I just said, I got to start sleeping better. I got to stop eating past 7 because I noticed like my HRV was going down, heart rate variability was going down. And then my sleep was interrupted on a regular basis. And what gave me the biggest clue was wearing a continuous monitor, where I noticed pretty much at 2 or 3 in the morning, I'd wake up, I'd be awake for a while, and I had a blood glucose spike. And it was because like at night, I'd spend sometimes too long doing intermittent fasting. Like I'd go almost 24 hours, 18 hours, 19 hours, and then I would gorge for like 6 hours. But that gorge was like from 2 to 3 to like 8 p.m., 9 p.m. sometimes. It was in that window. And sometimes, one of the weaknesses in our entire household is the damn popcorn.
Oh, yeah.
And then, that skinny pop?
Yeah,
so the skinny pop is not skinny, man.
I found a new brand I'm obsessed with.
So, it's for what, the Himalaya or whatever?
No, it's called, Lesser Evil. Please tell me
I haven't tried that one.
It's freaking phenomenal. And it's called Lesser Evil. It's supposed to be healthy. And I have bags of it, every flavor, but my favorite is fire. It's so good.
I gotta try that. That's my weakness.
I'll bring you a bag. We're going to dinner tonight. I'll bring you a bag.
So I spend 6 weeks where I've only had popcorn twice. And my other weakness is ice cream.
Oh, really?
Yeah. I haven't had ice cream in 6 weeks.
Wow.
Yeah. So I basically, I just said, let me just stop, take a step back, and stop eating post 7. Have spent a little bit more time on eating in the morning, which I never did before. I never had.
So you're not fasting anymore?
I'm not really fasting. No, I'll do like a 12, 14 hours pretty much. Well, if you think about it, I stop before 7. I don't really eat anything until about 9. So that's 14 hours.
But what do you have at breakfast?
When I have breakfast, it'll probably be a yogurt or it'll be a couple hard-boiled eggs, and that's it. And I notice I'm less hungry like during the day or when I get home. And then my wife will make whatever a lot of times for the kids. My wife's Mexican, so sometimes it's tacos, but even our tacos are like relatively healthy tacos because we make sure it's non-GMO tortillas, good chicken, good meat. And then she'll use to crisp them up. She'll use like avocado oil or olive oil to crisp them up. So a little bit on the healthier side, which are fantastic with some, guacamole or something like that. But I stopped, man. And then I noticed where before I would just be like, 4 tacos. Now it's just like 2 tacos, and let me just load it in with more lettuce.
When you bring up HRV, how important is HRV?
It's really important because your heart basically should be relatively variable in a constant, meaning when you're resting or when you're working out, you should be able to bring your rate down quickly. You should be able to bring it up quickly, and it should maintain at a specific level on there. So when it's really low, it's actually bad because it means that your heart's not as powerful in recovery mode. Mm-hmm. And it's important to get that up. And then one of the things that it also does when it's low is it puts like your autonomic system, which is what goes on naturally in your body. Things that you don't think about. Mm-hmm. Like for instance, fear is part of the autonomic system. If a tiger comes in front of you when you're on flight mode, that's part of the autonomic system. It messes it up and it throws it off. And that's what messes up your sleep, and it messes up a lot of things. It messes up your adrenal glands. It messes up all these different things that cause, for instance, cortisol to spike.
So wait, can you explain, is there a simple explanation for HRV? Because I have it on, I have the Whoop, I got the Oura Ring, I got the Sleep Aid mattress, and I look at the HRV and I don't know how to explain it to somebody. Like,
you're just looking at the higher the amount, that means your heart rate can basically rebound.
Okay, so what's your HRV?
My HRV now is like, it's like nothing. It's like 18. But my situation is different. The reason being it's so low is because years ago I suffered from what's called atrial fibrillation. And it's when basically the heart is basically, 4 compartments. The upper compartment is the atria, and the bottom one is the ventricles, which is the large muscle of the heart. The atria a lot of times helps control blood flow through because it goes through to the ventricle. So atrial fibrillation is when the atria is basically not conducting electricity the correct way and blood flow doesn't happen. I think it's the most dominant cardiovascular issue in the world. It's very, very common in, which was me, avid runners, because I was in the military, ran like crazy. It's very, very common that avid runners sometimes don't even know that they go into atrial fibrillation. It's basically the atria is trying to pass the blood, trying to conduct it through, the electrical conductance through, and it doesn't do it correctly. The bad part about that is it puts you susceptible to basically blood pools, and you can have a stroke or a heart attack.
So did you
This
fix
is what
it?
happens.
But you fixed
So
it?
what ended up happening was one of the ways to fix it, which I had to get at that because I was going into A-Fib.
I remember
I'd go
that.
to the emergency room and they would basically cardiovert me. So they put you under real quick, zap you. My wife went one time with me. She's like, oh, I never want to go again and see that again. She's like, basically you're lifted off the ground and,
I've seen the movies.
and then your heart converts again. Your
So
heart
yours
converts
is
again.
at 18 right now.
So
And
mine's at
that's-
18.
and
It
that's
used
low.
to be in the 70s, but ever since I got basically what's called an ablation. Ablation is where they go in and they burn the pulmonary node, which helps conduct the electrical aspects of that area. Ever since then, it's been bad. And
But can you get it better?
I can get it better, but not that much better. I've noticed that it's not, I've tried different ways to do it and it doesn't get much better.
So my HRV is a 9.
So that's similar. I'll range from 9 to, but you suffer from.
I have sleep apnea and I also do a morning show. So I'm like, you know what I mean? Like I think I've had 25 years of no sleep. So I feel like I've been really focused on my sleep now. So I can get it up, right?
Yeah, it's hard. Once you've been that long for that, it's a difficult task.
But does that mean it's in bad shape?
No, there's a lot of people that have extremely low. I know individuals that are really young that have extremely low ones, and they just basically, hey, try to find a way to relax. It just puts, you work a ton. You got to be on. You're on 24 hours a day.
Right.
People that are on a lot, their HRVs suffer.
That makes me feel better.
Yeah, because basically, it has to do also with the autonomic nervous system, and when you're on, you're on. You got to be on. You got to be on. You got to be. You got to be on all the time. That's like people in the medical field, people that are like scientists that are out in the public, individuals like me. Is like you have to be on because you don't want to make any mistakes when you're discussing absolutely anything with anybody. And it's not, it's not that simple. And dealing with science, patients, medicine, all of that, it's not easy. It really isn't, especially when you're dealing with sick people and you're trying to help sick people out there. It's a difficult task to deal with.
Well, let me ask you about when you're talking about weight loss and eating right. What's your take on these GLP deals? And have you heard of retatrutide?
Retatrutide, the new one. That's going to be probably a conversation that you're going to have with my colleague soon that knows that in and out. But the new one's supposed to be really good because it works in 3 different modes. And one of the most important aspects of it is the glucagon aspect so it helps tremendously with the liver. So it deals with a couple different pathways. All those drugs, there's a Cuban comedian that I'm Cuban American. And there's a Cuban comedian that basically says, my whole life, look at me, look how good I look. My whole life, this has been my GLP. Okay. He's just it forces you not to eat. Because if you think about it, I've tried it before, it makes me nauseated. And when you're nauseated, you're not going to eat. When you eat some food, when you're on that stuff, also sometimes you get heartburn, you get all these symptoms that you don't want to eat. So what does it stop you from doing is basically eating.
I went on the air on my radio show and on social media and said that you were coming on this podcast. And I said, what kind of questions? Like, because I ask you everything that I'm curious about, but I want to know what my audience thinks, right? So, my gosh, the response was tremendous. So, for specifically stem cells, somebody asks, where are these cells? What's the source and where are they harvested?
The cells that we use, we spend years studying various different cell types. And when we talk about stem cells, you can get them from an adult. But adult, actually, if you think about it, is anything post-birth. meaning a baby's born. And when a baby's born, it's the youngest source of any form of stem cells. You can get them from many places. When we studied them, we looked at obtaining them from post-birth umbilical cord tissue. Specifically, we studied what's called the lining on the outside, where I published a paper in 2010. So the way these are obtained, the way we do them is actually a mom is going to have a baby. We have to do vigorous surveys to make sure there's no family history of genetic issues, there's no problems as such. And then after we ask for under informed consent, we want to take a segment of that cord and start processing stem cells. These are pure stem cells because we do what's called culture expand them. We put them in a petri dish, we grow them up, we put them in a specific food, which is what makes our cells completely different than any other stem cell out there. Ours are focused on the immune system, which is key to health and longevity. Fantastic. They're not like any other cell type that's out there. You're going to hear the term stem cells
anywhere in the United States.
No,
There's
you
all
cannot.
These people popping up now saying we do stem cells.
Yeah, you cannot get them in the United States unless you're in one of our U.S. clinical studies.
Oh, that's the only way.
That's the only way.
Because I got people in North Scottsdale telling me that they can do it. I got people in Utah, people, and I'm like, these are different. And
unfortunately, they would be infringing on our patent if they did that.
So somebody else says, I'm curious about stem cells and our connective tissues, our fascia, how stem cells work. And with fascia, is that
yeah, if you think of, fascia is basically the lining in the vast majority, actually all muscle, and many connective tissue, meaning tissue that connects one part to another part. And it's what covers it. And it helps strengthen it, because if you think of the propensity of what some of the cells do, is some of the cells deal with basically changing into cartilage, bone, and fat. They have the ability to do so, meaning in a petri dish, but it doesn't necessarily mean in the body they can. But they do release signals and communication skills that can help heal the fascial injuries, these type of injuries.
Yeah, to me, I think that stuff's a miracle. You know what I mean?
It doesn't cure everything. It doesn't take care of everything. It's not for everybody.
Who's it not for?
You know, it's you would consider individuals, which a lot of people are plagued with it right now, is like people that have extensive viral issues. You have to watch it because you're going to regulate the immune system. And sometimes you don't want that immune system that regulate it. And you'll actually look up papers, scientific publications, where they discuss individuals that, for instance, have high amounts of Epstein-Barr virus, which is a horrible virus. These individuals are at risk of getting flares because the immune system becomes regulated, versus you want an immune system that's more focused on killing. The other thing is in the context of cancer. So there's different types of stem cells. One of them is for bone marrow transplants, which is a blood-based stem cell. That's the one you do when you have ALL, leukemias, these type of things, that you're going to transplant the entire bone marrow into a patient. And this is a really difficult procedure because of, like the boy in the bubble, person's in an isolated room for a long time. You basically eliminate their own immune system, and then you rebuild it with these blood stem cells.
But not your stem cells.
Not our stem cells. Our stem cells are different. They regulate the immune system. And the problem with regulating the immune system and cancer is you really don't want that. Because if you look at cancer patients, they will have a specific type of T cell, which is a regulatory T cell that's regulating their system. And in these cancer patients, it's even elevated. What does that mean? That means that it's trying to regulate what you want. When you have cancer, you want your immune system to be killing, attacking. If it's regulated, it's not going to be killing and attacking. That's the problem. You want to look at these type of patients too, is, that's why we don't add these cells. Besides that, these cells also can increase a specific factor called vascular endothelial growth factor, just a factor in your body that helps build blood flow, that helps build new vessels in the body. And you don't want that, because when you have cancer, it's mostly vascularized to that area. So you want to avoid that. That's why you want to use that.
Is that where NK cells can come in?
That's where natural killer cells come in.
Which you guys do as well.
Which we do as well, But we do it more in the context of senescence. And there's now a direct correlation with senescence and cancer, actually, believe it or not.
Oh, really? 'Cause
Yeah.
the cells are just not doing anything.
Correct. Cells are just not doing anything, causing actually mutations in other cells because they also communicate bad things out there and they cause, communication issues. They basically just occupy space in the immune system, let's say what's called immunosenescence, and you have a problem at hand.
I interviewed this woman. She's been in the stem cell world for like 20 years. She was taking actors and people to Moscow 20 years ago.
Yeah.
And she discovered your clinic. And she said, out of all the years she's been researching stem cells and going, she said, your clinic, ReHealth, is by far the best of the best of the best.
Thank you for that one.
And she was amazing.
We try hard. I mean,
Yeah.
it's US-based technology. We focused on
Yeah,
that.
it's amazing.
And, teaching them everything, giving them everything, also doing audits over there, having the quality regulatory team from here doing audits over there, having basically outside entities do audits over there, other academia, basically other universities
great.
have actually gone there and done that, just to assure that manufacturing. The biggest problem in the United States is everybody, what you just said, has stem cells. Everybody, not everybody, but I got to tell you, 99% of the people have zero clue of the difficulties of manufacturing and sticking correctly to the FDA guidelines. If you do so, you will have a safe cell. If you do not, which I hear people talk about, they have a GMP facility. I've been to these so-called GMP facilities, and they are not what's called good manufacturing, any of it. They don't follow any form of good manufacturing production, any of that. They think they do not. And that's what causes problems.
Right.
Besides that is these, for instance, you look at a lot of these people say, I have stem cells, and they'll just take fluid from a baby, amniotic fluid, and then they'll produce 100 vials of this, not understanding that there's some stem cells in there, but there's hardly any stem cells in there is number one. Number two is you have antibodies in there. Number three, you have proteins in there. You have a bunch of stuff in there because it's a filter. This is where a lot of the stuff is filtered through, and it's where it helps. There's some protein in there. There's some good regenerative factors in there. But there's issues in there when you discuss putting this into another person. Because the last thing I would want is an antibody from somebody else to come into my body. And especially for those that, a lot of people worry about the spike protein and all viruses and all that. Yes, they do testing, but they normally don't test for current infections.
What about exosomes? Where's that in the stem cell chart?
It's right below the stem cell chart.
So you'd rather have stem cells than exosomes?
I 100% would. And I can sit here with any exosome scientist and have a perfect discussion about why a cell's way better.
Okay, you said someone, I got 2 billion exosomes. And I was like...
And that doesn't really matter because what do I care? Guess what? 1 billion exosomes, 5 billion exosomes. I can get an exosome from a cheek cell and grow up cheek cells and produce exosomes. I have 5 billion exosomes. So what? What is that exosome going to do? What's the active ingredient? It's no different than a pharmaceutical, than a drug. What is it going to do? What is in there? Talk to me about what's in there. Talk to me about mechanistically how this works like a drug. I'm not going to take a Tums for a headache.
Right.
Well, you might, because the gut and they do work together hand in hand. But I'm not going to take a Tylenol, let's say, for a stomach ache, because it doesn't work. And exosomes are manufactured just to be one thing, where the cell and your body on a daily basis strives to live. It does not want to die. It does not want to turn over. It doesn't want to do any of that. And it does so by communicating to its environment, other cells surrounding it, to figure out, how do I produce, the cell as a machine, how do I produce something to survive? Mm-hmm. And that's the key to a cell. I put a cell in a harsh environment, like for instance, somebody that's sick, and it sits there and it says, what the hell happened here? I'm in a different environment that I was used to, where I was in an ideal environment, that I was growing well, that I was made for a specific reason. Now I'm in a harsh environment. How do I change this environment to make it healthy? The machinery of the cell basically is forced to produce these correct exosomes, the correct, what's called secretomes, secrete out proteins and different things to survive. How do I know this is true not only in the body? If I put on a Petri dish a cell and I feed it, and I see this all the time, a specific factor, and I can check to see if it starts producing the factor. And if I remove that factor, the cell all of a sudden in a petri dish, you can see this literally, starts to connect tighter to its surrounding cells. And there's some form of communication that happens that says sort of like, uh-oh, because you can check this, it stops producing something. All of a sudden, in a matter of time, it can be a day, 3 days, 4 days, you'll check what's being communicated, you can pull this out, and it starts producing what you removed.
Wow.
That's how smart the cell has.
Wow.
The tremendous amount of innate intelligence.
Right.
You know, we're made to survive, we're made to live long. It's just we're burdened by, you know this, I mean, so much nonsense out there, the environment, the food, toxins on a daily basis, mental health is, you know, affected too. I mean, just everything that you're dealing with, and surrounding yourself with negativity just makes things, you know, worse. There's so many different things that you can, just simple things that you can do to change your environment. And I know you get this slack from people of, well, it's not affordable, or this is not affordable. Guess what? There's nothing more important in your health. Try the baby steps. There's baby steps. Jesus, you can't afford it. Okay, I get it. Save, because, you know, your health is one of the most important things. People complain about, I think that's comical, about paying too much money for a mattress, finding the right mattress to sleep. Man, how much time do you spend a day on a mattress sleeping?
Right.
8 hours. It's basically a third of your entire day on a daily basis.
Did you find a good mattress? Do you have a good mattress you
Yeah,
recommend?
I did. I mean, I love the Sattva. I love that.
Oh, I've heard of that one.
I went with that. I tried a bunch of different ones. I love it. It's been working out great.
How do you
for me.
pronounce
No
it?
aches. Huh?
How do you pronounce it?
Sattva. Yeah.
Oh, I've seen it. I thought it was, for some reason, I thought it was like stevia.
Yeah.
stuff.
It's like stevia.
Yeah.
Let's go close to that.
Have you
But
tried the sleep aid mattress?
I tried the
I mean, it's the cover.
Sleep. No, I haven't tried that.
I got one of those.
You got the cover?
I got the cover, and it has water, and it does whatever. And so now I check my sleep on the sleep aid, the O-ring, and the Whoop. And only once have they all been the same number. Other than that,
they work differently.
They're all battling each other out.
Yeah. The only problem I don't like to deal with too many of those is the you know, your Bluetooth EMFs.
That's true.
All that stuff. It's just like a little bit too much, and who knows? I don't know. I'm a little weird with that.
Hey, so how did this start for you? Like, what made you want to get into this? Because you said you were in the military. Like, how do you become one of the top stem cell scientists in the world?
I was in the military. Then after that, I went to sales. I had to work, and always had in the back of my mind, always was health. Always had a fascination with medicine, trying to, you know, get into medicine. And at some juncture, I just said, I was in real estate. I started selling real estate for a while. I was doing well. And at some juncture, I just said, I need to focus and go back to school. And the biggest trigger point was when I was working and I got a back injury. And I became fascinated with, how do I heal this? How do I fix this? What do I need to do? And the craziest thing about it was, you know, when you go to the doctor, the orthopedic surgeon, he's going to tell you,
operate.
You need surgery. And I was like, I ended up getting surgery originally, but I noticed how much relief I can get when I looked at natural methods. Like back then, it's sort of crazy. This thing called prolotherapy.
Oh yeah.
That people still use it.
Right.
I tried prolotherapy. I got better. I started inverting because I had an L5S1, you know, lower back, basically compression and a disc herniation. And I had compression of one leg nerve that was killing me. And I started noticing how I would get relief. But I noticed for my lifestyle, which when you're in the military and you run and you're used to exercising and you want to be physical, that wasn't going to resolve my issue. And I wanted to continue to deadlift. I wanted to continue to do squats. I was playing racquetball. Every time I'd go play racquetball, sometimes when I'd go too hard, I'd be out for 2 or 3 days. So I said, forget about it. I'm going to take the risk and have surgery, which I had surgery. You know, I prolonged it. But the recovery from surgery using all those modalities, heat, cold, prolotherapy this is 30 years ago. Where I now, you know, I can deadlift, I can do everything. Even though I've had L5S1 fusion, I can do, you know, basically they remove the disc and they fuse 2 vertebrae. I don't have as much bend as, you know, standard person, but I can still touch my toes easily.
But if it was today, would you have the surgery, knowing what you know now?
If it was today, no. Knowing the power of what I've seen,
Right.
absolutely not.
What would you do?
I would go with cell therapeutics. I'd go with my colleagues that I know, individuals that you have seen that have treated you 100%.
You would do what I did?
100%.
I was going to say, that to me,
100%.
that dude, that procedure I did, which I still don't know how to explain to people, because I know you can go to ReHealth and in the clinic, you get the injections in your back.
Yep.
Then you do what I did, which is I went to the hospital and they put me under, and it's unbelievable how well my back feels. I feel right now as I sit across from you, I feel fantastic. And that's very rare for me, you know?
Yeah, there's people just don't understand. That's a different procedure because yours had to go a little bit more invasive.
Yeah.
Versus standardly, for a lot of individuals that have like, you'll go and you have a herniated disc, which is common, or you'll have basically degenerative disc where, it's starting to compress down. The problem is the sector just looks at one problem, not understanding anatomically well. Like you guys have a great doctor here locally that understands it really, really well. Dr. Goyle, he's phenomenal. Yeah, he's great. And if you look at what you need to do to fix these type of issues is, okay, I know I have a problem here. I'm not going to anatomically fix that. But if I strengthen all the structures around it, because of that injury, everything has got laxed and loose. If I can strengthen that, I can almost guarantee you the pain is going to be gone. So if you look at, for instance, back problems, which my PhD is in spinal cord injury, I know the spine really well because I suffered from it. I talk to people a lot of times of little basic things that you can actually do to help, alleviate a lot of the pain and get rid of it. Is if you look at what transpires with an injury, and if you look at how do you fix the surrounding, stabilize it, you will get better. And honestly, I don't really care. And I've seen this. And there was actually a publication they looked at 1,000 MRIs on spine. Half looked horrible. Half looked good. Guess what? When you talk to all these people and you went through the full surveys of the pain, what they can do, there's no correlation with this bad MRI versus this decent MRI. None.
What do you mean there's no correlation?
No correlation with the pain, with their disabilities. None.
You mean it didn't make sense?
It didn't make sense.
So is it phantom pain? Or is it?
No, it's pain, but they don't know why the pain. Maybe there's...
So a lot of people have back pain.
A lot of people have back pain.
And they'll look at the MRI and the back pain doesn't make sense.
It doesn't make sense.
So what does that mean?
It doesn't meaning
mental?
They have a minor injury and the back doesn't look that bad versus you'll take, for instance, because of my fusion, you take an MRI on my spine, which I just did one because I did a shoulder and MRI because I blew my shoulder out months ago, which is perfectly fine now. You look at my spine and my colleague's pain management, he's like, your spine looks like a mess. And I'm like, I don't have any back issues.
Hey, wait. With your shoulder, did you get stem cell injections?
Yeah, I had 3 tears. I couldn't externally rotate. I couldn't even, what sucked is you take things for granted. I couldn't reach into the dryer to get my clothes out sometimes.
And now you can.
And now I can.
And all you did was the injections of stem cells.
All I did is, And
Dr. Waheed?
The healing took a couple months. Which is way quicker than when I went to physical therapy. They told me, you might have to have surgery. This is going to take you 6 months to heal.
Right.
I did the combo of physical therapy plus because
no surgery. It's a benefit.
But no surgery. But I was back in 3 months. I was almost back to where I was prior to the injury. I mean, 2 tears, shoulder separation, bursitis. It was bad, and
now you sit here.
I'm pressing the same as I was before now, and I'm doing fine. I don't have that external rotation pain. I still do have something which I'm going to get an MRI done with the AC joint separation, which I got to figure that out. But I'm sure I can figure that out.
Wait, so you hurt your back. You still haven't. How did you get? What made you get into this? So you hurt your back. Then you go where? Where do you?
I go to school.
Med school.
Focus on. No, I ended up. It's funny because I end up selling a house to put myself through school. End up moving into something a lot cheaper, a condo, and just tell my wife I'm going back to school full time. I got to get this done. And then just end up going to University of California, Irvine. I was fortunate that as an undergraduate going there is when stem cells in 1999 started. It got big in the Christopher Reeve Paralysis Foundation.
Right.
That's what put it on the map.
Right.
Christopher Reeve got injured. How do we get stem cells in the sector? And how do we work? I worked in that group doing this. And I was fortunate to work in this lab that originally the plan was, let me go to medical school, become a medical doctor. But then I said, wait a second. I think I'd like to mechanistically develop something which is what's called from bench to bedside, and bring what I develop to patients worldwide.
Mm-hmm.
And that's where we're at now. We're at a company, that US-based company, that basically we're in clinical studies. We're further along in clinical studies. You know, if everything goes well in a specific autoimmune disease, in the next couple of years, we can have an approval.
Wow.
You know, which would be an FDA approval, which insurance would cover it. Because we've even done the work on, will insurance cover this? Will they not cover this? All of it.
You mean in the United States,
In
this
the
would
United
happen?
States.
That insurance will cover it?
Yep.
You don't think that the higher ups, the big pharma people, are going to shut this down?
They might want to buy us out, and that's for a company, that's a good problem to have. But as an individual, as myself, that has spent years doing this and developing, it's a bad problem to be in.
You know that company,
I don't like that.
Peptide Sciences?
Yes.
You heard what happened to them?
They shut down, probably pressure, government pressure, everything, and then honestly, it's a competitive sector that.
Right.
People hate people. Like, you know, it's
because it was working, right? That stuff was working.
The guy that ran that was the biggest in the sector, one of the starters of all of it, one of the educators of all of it. And he started it, built it up, produced it, was doing, you know, was doing pretty good work. Then people started slamming him because the stuff is from China. Well, guess what? The stuff that you buy in the United States, the stuff that comes to make that comes from China. The vast majority of it.
I heard Big Pharma bought him and then shut it down.
I don't know if that's true.
That's what I heard from somebody.
I don't know. I wouldn't. I mean, that wouldn't surprise me if somebody offered him, you know, a lot of money to shut it down. I mean, there's been things like that have happened or they'll, you know, Big Pharma sometimes or other companies will buy another company to shelve it.
Well, I got another peptide plug for you if you want. I'll give it to you when we're not rolling cameras. What's the biggest miracle success story you've seen from stem cells? Is there one or two or 30? I mean, I know people, but I just mean, is there one that's just like, whoa?
You know, yes. So we published a paper in 2008, and this was back then when I did a lot of work with bone marrow stem cells. And I was, once again, in the spinal cord injury sector. I was fortunate to meet a group that ran the largest hospital in Ecuador. They would see over 1 million patients. The individual that was an anesthesiologist, and he started stem cell sector back then too, in 2005, 2004, had all these spinal cord injury patients. I said, how do we set up a government platform to study these individuals with stem cells? It's funny because when I went over there and tried to get this stuff approved, these guys were like, back then, this is witchcraft, this is nonsense. You're going to get people sick. You're going to get this, you're going to get that. And when we started, I said, listen, these are individuals that are, some of them with gunshot wounds, that have been in wheelchairs for 10 years. How do we give these people some hope? Like, and it's not even hope for somebody that's in a wheelchair. People think that they want to get up and walk. No, the number one thing that they want to do is regain their sexual function. And number two is, believe it or not, their bladder function. Can you imagine not being able to live with the control of your bladder function? Or if you have to basically go pee and you don't even feel it, you have to have a catheter in all the time. You're susceptible to infections. And if you don't have a catheter in because you're like, I don't want to do this, you don't feel it, you can get this thing called autonomic dysreflexia, which basically your bladder's full so bad, it extends so bad, you can die.
Jeez.
I mean, it's really, really bad. And then they agreed to let us do a study. And we did a study on 8 patients of 4 recent injuries versus 4 old injuries. We're talking about individuals that were 10, 15 years. And what we saw straight across the board in all of them, we published this paper in 2008, was that these individuals all of them regained the majority of their bladder function.
Wow.
Which was completely neat. It was something that nobody knew back then.
Was it just an IV infusion?
It was done a little bit different. It was an IV along with a surgical procedure where what we basically did is open the spine and clear out some of the injury. It's called detethering, because when you get a spinal cord injury, you know, think of electrical lines being sort of like this, just straight. When you get a spinal cord injury, these end up getting like this, and you get this scar, and it's a particular cell called an astrocyte that becomes an astroglial cell. And those are supportive cells, and it basically blocks all the signaling. So what we did in that was that there was a clearing a little bit of that scar, and then inject it into that area, not into it, but above it and below it. The concept behind there was, I want it built here and here so I can get a regenerative effect to try to make the correct, you know, synapses, basically the correct connections.
And it worked.
It worked relatively well. What we ended up seeing is the bladder function. All of them improved significantly. All of them regained some motor function, meaning those that had an injury in a specific area that, let's say that they couldn't bend at their ankle, started all of a sudden getting some regain. Those that had lost complete sensation below that injury, which is common, started getting sensation and feeling below those injuries. So it was successful in the context of, and this is where the neat story goes, is it was successful in the context of it helped improve their quality of life. But the neatest thing that sparked my interest was there was a woman that had what's called a complete injury. And she had one goal. She had tried since the time she had an injury for 3 years to become pregnant. She couldn't get pregnant because of her spinal cord injury, because of her issue. She serves as an internal control, meaning when we did that surgical procedure to her, we didn't put any stem cells into it. She had no changes. 6 months later, we put cells, according to the way I told you. She improves her bladder function. She improves her sensation, her ability to move her legs a little bit. 6 months later, she gets pregnant.
Wow.
She has a baby. A year later, she has another baby.
Wow.
So that was one big success rate. The other one was which we know we have a common colleague, heart patient, that did really well.
Oh, yeah.
Yeah. And I had an individual from Canada that was on the heart failure transplant list. This individual he had an ejection fraction of 18. He's in bad shape. The guy can barely bend over, tie his shoes. He was another one that was a fascinating case that I was like, this can't be, this can't be anecdotal. And you have individuals, as you know, come back and their heart surgeons or their heart doctors are telling them, how did you do?
Right.
How did you improve like this? And,
right.
Well, this is what I went and did. But this individual went from what's called the grade 4 to a grade 2, where a week later, his passion was golf, went back to basically play golf. But the neat aspect about him was he was like, listen, not only did you help improve my quality of life, but I have not had sex in 4 years because I couldn't get an erection.
Mm-hmm.
So when you increase blood flow, of course, for men to the penis. You get a hard on, you can have sex.
Mm-hmm.
That's what happened to him. This guy's 60-something years old. He ends up having a kid.
Whoa.
with a young lady that he got together with.
Wow.
So stories like that are fascinating, and they're not, there's several of them like that. We've been fortunate as that we've focused on safety. We haven't had any non-safety issues. Our clinical studies in the United States here show a complete safety profile. We've had one adverse event, which is a flushing reaction. We know we focus on safety because ultimately, whatever you make, and that's what people complain about the FDA, but guess what? The FDA is after your personal interest of at least show something safe.
Right.
And then later on, if you show some form of efficacy, something improves, fine, but make sure you list out, that's why you do these clinical studies. What are the adverse events? Mm-hmm. When you go to those commercials at night, which are crazy, hey, you're going to get your skin better, blah, blah, blah. But then after you have 5 minutes of, you can get cancer, tuberculosis,
all the side effects. A lot of people are laughing, having a good time.
Because all of those were tested in these clinical studies, and these are some of the effects that these individuals got.
Right.
Which is what you have to look after. And we've been fortunate that so far, we haven't had that bad safety profile, on anything. So it's been really good.
So if you get an IV of 200 million stem cells and nothing's wrong with you that you think of, it'll just benefit you overall.
Correct.
You might not even know that you had something wrong with you, right? You might even know it just does what it does.
Well, what you're talking about is if you're a healthy individual, for instance, and we tested this many years ago with UFC fighters. Mm-hmm. And number one is when they came to me, some individuals from the UFC, this is back in 2011, was how do I improve my performance is what we discussed. Mm-hmm. And my number one concern was, we treated some of the big guys back then. And my number one concern was I'm going to treat one of these guys and then one of these guys tests positive for steroids or something, they're going to come back mm-hmm. and they're going to blame it on me. We did something. So what we ended up doing was testing their blood beforehand and then treating them and testing them regularly after to see if it did anything to increase erythropoietin, to increase testosterone, to make any changes. And it did not. But straight across the board, all the fighters reported basically their in-between time, and this was 7 different individuals, their in-between recovery time of rounds improved significantly. And their big test for basically being in shape was the VersaClimber, which that was back then.
Oh yeah, no, that thing's
that's
monster.
a brutal machine. Yeah,
it's terrible.
So they would. How can they improve their time on the VersaClimber? They all consistently improve their time on the VersaClimber, and then many individuals that got like their spines. Have a couple of the individuals that had to stop because, basically herniation of a disc, too much back pain. Had to take a steroid injection for back pain. Went back and were perfectly fine.
So when you get a stem cell IV, how long are they alive in your body? And
not long.
Because they're just kicking off something.
They're kicking off stuff based on what's going on with your body. Not long. We don't know exactly because we're not allowed to do that in humans. In mice, for instance, the mouse studies that we did, they last about 14 days. They start off and they stay in the lung first, because when you stick an IV of anything, the first stop is lung, and it's like liver, spleen. Then it'll go actually down to the gonads, and then it actually travels back up. Last stop is like the brain. And what we saw in the mouse models was that about 7 days, you would see few cells up in the brain. Those are cells that have to smash through and be able to get through where you can see them. But in humans, you'll see, you have to take what's in the context of a mouse model and multiply it, which is what we normally do. Right. Multiply it by how long does a mouse live versus what a human lives. And if you look at that, we assume that cells can live a month, 2 months, 3 months, depending on the individual and the environment.
If you're a typical healthy person.
If you're a typical healthy person, it's probably going to live relatively long time.
And if you're a typical healthy person, how often should you do stem cells?
I would say it depends on your age, depends on if you're over 40. I would recommend you do this every 6 months to every year. Mm-hmm. For sure, if you're relatively healthy. And even more important is the NK cell is fascinating.
Right. That's a whole different.
What this does. For me, that is, I believe, and what I've seen, it's probably the golden ticket to longevity.
NK, more than stem.
Cells.
So explain that one really quick.
So the natural killer cell is basically the cell type that's the immediate responder to a virus. So any viruses that go in your body, it's the first one that's supposed to respond to it, remove it. Any mutated cell, cancer cells, it's one of the first ones that's supposed to be responder to it. And then lastly, a senescent cell. Senescent cell is a zombie cell, occupies space, causes havoc, causes issues. We talked about communication of cells. A senescent cell releases this stuff called senescent-associated secretory phenotype. It's exosomes and other stuff that's crap.
Right.
That causes the surrounding area to become bad. So much so that we do experiments in our lab, and we will take a senescent cell and we will mix it with a younger cell, and what you will get out is an older cell. Especially if you let it sit for a long time, that younger cell will become older and older.
So if you put the NK cell, it'll eliminate the older cell?
So if you put an NK cell in, this job is to remove virus, mutated cell, and a senescent cell. So long as the NK cell is active. And we're, as a company, at a juncture of now identifying specific proteins and killer receptors on individuals that so far we've pulled 10 different people, and only one, which has the greatest propensity to kill senescence. There's a specific protein, which I can't talk about, killing receptor that I can't talk about yet, because we, of course, are going to submit documentation for it. That individual has, that is a superior killer than others in the context of senescence. So there's individuals that carry a better ability to kill their NK cells than others. As you age, the NK cell becomes.
But you can only use your own NK cells. You can't use other people's.
You can use other people's NK cells.
You can?
Yeah.
Oh, I didn't know that.
There's a ton of studies now in cancer.
Oh, wow. So if you have cancer already and you inject the NK cells, the hope is that the NK will eat whatever cancer you have. Because I know a woman that goes to your clinic, I think, I'm going to say every 6 months, maybe less, and to get NK cells. She's 90, stage 4 bone cancer. I met her, and my aunt was perfectly healthy, and this woman had stage 4 bone cancer. My aunt got bone cancer. My aunt died, and this woman just bought a Porsche. and she's 90.
I know you're talking
Yeah, I
about.
know you do. And she's still getting NK, I think she gets STEM too. I think she gets both.
No, she only gets NK.
Oh, she only gets NK? Yeah, but I think that NK is keeping her around.
We've had several individuals like that.
That's unbelievable.
That has worked tremendously well with it. Yes.
So when you take NK, and like for me, I've done NK twice, and I think the first time
that's autologous from you. Yeah.
What does that mean?
Meaning it's from you. I take your blood and I produce. But the difference is when I produce this and I grow this up, I actually activate it to somewhat of a younger state to make it a killer. Like if I took your regular blood right now and I isolated your NK cells and we put it on specific cells to try to kill them, which we test on a regular basis, you're probably killing at maybe 10 NKs to 1. So you like a gang members of Johnjay, 10 on 1. When I take your cells and I produce them, I grow them up, I expand them, I activate them in a method that we actually do, and I put them back into you. They become killers of like anywhere from 3 to 1 to 1 to 1. Not only that, but they do something called serial killing. And serial killing is when 1 or 3 can then kill a cell, come off, and then go back and kill another cell, come off, and kill another cell.
Well,
at some juncture, they run out of gas.
But is that what happened to me? That's what mine did?
Correct. Yours, similar to yours and other individuals too. That's the way we know that they're active.
Well, the first time you did it for me, you took 4 billion and then you gave me 2 billion and you froze the other 2 billion.
Correct. And we gave you another 2 billion.
If they're frozen, it's fine. They just unfrozen. If you're frozen,
it's fine. We have a specific method of thawing them and activating them.
You don't have to reactivate them?
No, we do. We do something specific to activate them.
I had a billion, all these people had all these questions for you. Like, you know what's funny? I just got a text from a friend of mine who's at your clinic right now. Right now, texting me from there. He's getting his knee done and his wife's getting his shoulder done. That's crazy. Like literally as I speak to you, I have so many questions and I know you got to go, but from people that are, does this help kids with muscular dystrophy or Duchenne?
That's a great question. So we embarked many years ago we got an approval from the FDA to do a Duchenne muscular dystrophy study. The individual was supposed to fund it, never ended up actually funding it, even though we raised some capital for it, which was a nonprofit. It should. There's a company that's relatively farther along now. It's called Capricorn, and what they show for kids for Duchenne muscular dystrophy, they have a different type of a cell. It's from a heart cell, and what they show that it's like a heart stem cell sort of, and what they show is that it improved heart function. Children that have Duchenne, normally, first they start losing a lot of times mobility of the legs. Secondarily to that, they actually then start losing basically heart function. That's where they end up. They end up being on steroids. That's where they end up succumbing to disease a lot of times. Not necessarily the mobility thing, but the organs start to shut down. We have embarked on a clinical study in the United States at Stanford with the owner of Lululemon, which is a group called SOLVE, Facial Scapular Humeral Muscular Dystrophy. It's a type of muscular dystrophy that's rarer than Duchenne muscular dystrophy. And the reason why we embarked on it, and they selected us out of 60 companies to do this, is because the data we got from another clinical study, which is that autoimmune disease that I told you, which is, it used to be called polymyositis, dermatomyositis, it affects the muscles. Individuals with this autoimmune disease, what ends up happening is that when the muscle is attacked by your own immune system, the muscle becomes fatty and non-functional. The same thing happens in Duchenne and in facial scapular humeral muscular dystrophy. In a lot of these, almost all the muscular dystrophies, it becomes non-functional. Those are genetic diseases, but the concept here is to slow down the destruction of the muscle. So if I can stop that destruction, then I slow down that path to them ending up being in wheelchair, for them ending up having issues.
But if somebody has a child with that, would you say go get stem cells?
I would say go get stem cells.
Go get stem cells. And
if it was my child, I'd say we need to get you
go get stem and go as often as you can.
Correct.
Okay.
Yep.
I know you've got to go to another podcast and then another podcast. And then you're meeting me for dinner. Well, let's say, what can we say? Let's go to rehealth.com. Where should people, if they want to contribute to, if somebody wants to donate to any of this?
Yeah, you know what? Go to rehealth.com. If you're interested in getting cell therapeutics, see if you're a candidate, number one, to see if they'll take you as number one. Number two is another interesting platform that we are looking at to study here in the United States is the individuals that have autoimmune diseases because the cells that we use work really well in autoimmune diseases. And that's actually It's Horizon's platform. It's basically where you're allowed to go. We monitor your testing before, after, and you can go get these cell therapies and we can do it. We're looking for individuals that have autoimmune diseases that are refractory to medications, meaning you have an autoimmune disease, you're trying standards of care, which can be steroids, biologic, or another thing that's called a DMARD, those type of drugs that are out there, and you're not receptive to it, you're not getting better, you're not improving, reach out and we can consider you for this platform.
So go to Horizons.
I think it's Horizon's platform.
Horizon platform. Just search Google.
I think it's Horizons. Yeah, okay. I maybe I can get you that after.
Because so my friend, he had ulcer colitis, pancreatitis his whole life. Been in the hospital 2 weeks, almost dying every year. Once a year, goes to the hospital. He got stem cells from you.
Yep.
And I tell this story all the time because it's exactly true. I'm not exaggerating, and don't have the medical background, but he got an IV drip and was cured immediately.
It's relatively quick.
They were like, hey, let's go. We're gonna go eat enchiladas. He goes, I can't eat enchiladas. And the doctor was like, you can eat enchiladas. And he's like, I can't. I get sick. And he went and ate enchiladas and didn't get sick. And I'm sure it was the prednisone and it was whatever in the beginning.
There's other things in the beginning.
It wore off. It's been 2 years. And he's been off all meds, has not gone to the hospital. It's literally a normal, typical life.
It resets your immune system, not in everybody. For instance, we have a case that we did here in the United States, FDA approval, what's called the compassionate use investigation of new drug entrance to the FDA, which we can do that too on individuals. And this person was an 18-year-old kid, had to stop going to college, which mom has now made a video about this. Skinny as skinny can be, urgency, bleeding. You can't leave your house. You have to go to the bathroom. You're in the bathroom all the time.
Right.
He was on all the different medications. None of them helped. We then started putting him on infusions. The first infusion, he improved a little bit. 3 months later, because then he got worse. He was a severe case. We treated him again 3 months later, got better. 3 months later, 3 months, 6 infusions in, he was in remission of disease plus removal of that drug.
See, so it works.
It works. I have the individual that is fully funded, our furthest along platform, that polymyositis, dermatomyositis. She is now in remission of disease, and she is seen at Brigham and Women's Harvard. She's seen there. Her doctors are there. They're blown away. They just tell her, keep doing what you're doing. She's in remission of disease off all meds, off all immunosuppressants, 4 years this past February. Because she called me, she told me, look at me now, look at how well I'm doing. This is amazing. On her 3rd year anniversary, she brought me a beautiful gift. I was like, thank you, but I don't need a gift.
Hey, what about women that suffer from endometriosis? Can stem cells help with that?
It possibly can, because that's a shedding and that's a vascular issue, and it possibly can. It's a hormonal issue too.
Isn't it autoimmune? Isn't that immune or something like that?
No, it's inflammation of the lining. And then it sheds, and there's a lot of problems that transpire with these women. For instance, we have treated women that are perimenopausal and menopausal, and it'll put their cycle regularly. And we've had some women that have had endometriosis that has helped tremendously. So if you're having that issue, it's a possibility.
Interesting.
Yeah,
okay.
We just need to understand more. We're real details, as you know, with what's going on, what else are you taking, what's your lifestyle, what are you doing, how do we help it?
I'm a big promoter of ReHealth and you guys, and it's so interesting to me because I just tell people, I give them the website and I just call there, just talk to somebody there, right? I know the whole staff in Cancun now.
Yep.
Like you have such a wonderful staff. Yeah. That's the part that I also, we don't highlight enough too, is that everybody that works there is so caring and nice.
Yeah.
They're from the Cancun office. I've only been to Cabo office once, but I mean, the Cancun office people, they're wonderful human beings.
They love what they do. They enjoy it. They see the difference in individuals coming back. It's crazy because our business, the majority of it, the one over there it's mostly repeat.
Right.
It's a lot of repeat because people are seeing the benefit. And ultimately, it's your choice to invest in your health versus investing in a car or doing whatever it is. If you want to live longer, you want to live a better life, you have to spend money. I don't depend on, I have medical insurance just in case of an emergency, but I spend money on, you do too, on supplements, on equipment, on this, on that. You got to make it a priority. If you want to live, a healthy life, you want to be there for your kids, you want to be there for your family members, you got to invest in your health. You have to. You have no choice.
Well, that's another thing too. When I've talked about my kids, they torn meniscus, ACL repair, they get injections in their knees with stem cells, and they're 100%.
Yeah, kids, they heal actually really quick.
It's crazy, right?
Yeah.
I mean, my son's had a hell of a senior year playing basketball because of the injections in his legs. I mean, it's unbelievable. I think it's a miracle, and I'm going to keep preaching that it's a miracle. I think it cures everything.
Well, you're gonna talk to Brian soon, and Brian,
I can't wait to talk to Brian.
How did he get into this sector?
Oh, I can't wait! I got so many questions for Brian. I can't wait.
Because how the hell do you go from trading and telecom to
a full head of hair?
to cell therapies, to cell therapies and regenerative medicine.
I got more questions. I just
throw some more questions.
I thought you had to leave. Do stem cells help? Do stem cells help with mental health?
That is a great question and a really difficult question. We have to consider that. I would probably say no, but I would probably say that I would say that we can make some changes in the context of using exosomes there.
Oh,
That's
really?
a little bit different. And the reason being is because there's new methods now that you can, for instance, and it's got to be studied. Like we're embarking on studying addiction, which addiction is a mental problem, with exosomes done intranasally. So intranasal is just like a nasal spray. And you have a small area here, which is the cribriform plate that you can actually pass through, and things can get into the brain. For those of us that have, I'm a scientist and I try everything I develop. I'm just like, let me try it out, see what happens. Hopefully nothing goes wrong. Nothing's grown. I haven't grown a horn yet or anything like that. So I'm fortunate. But I do see how this can work and how it can basically change neurotransmitter, which is what you look at, is that you look at deficiencies or you look at problems with the way neurons are basically releasing their signaling from one neuron to another. And I can see how it can change, the possibilities of serotonin, dopamine, other different types of neurotransmitters.
When you talk about addiction, don't people use, they use ketamine for, or initially NAD plus or NAD? Wasn't
correct.
NAD
Long time drips for long days for a long time.
Right.
To basically get rid of yes. So, and then you look at change that makes changes in neurotransmitters in the brain is what it actually
short
does.
answer, stem cells help with mental health? Maybe
in the future, maybe it needs to be studied a lot more. I'm really hesitant with it. I'd more tell you like a simpler approach would be what I just talked about.
Okay.
And people are developing this already, including ourselves.
What about, here's another question. Please explain the difference between peptides and stem cells, the pros and cons to both.
Oh, it's like
totally different.
It's totally different. So peptides are short sequences. You manufacture these normally synthetically. They're manufactured, which doesn't make them bad. You produce them. Each peptide has a specific role. It does something specifically. For instance, if you look at, let's talk about the one that's mostly used, the safest one of all, BPC 157, body protecting compound naturally found in the gut. Originally, it was thought, which it does, it serves a purpose in the gut. But when people started using it and they had like minor tears, injuries, muscle injuries, ligament tendon injuries, they saw that they started improving. So it's like a secondary effect, similar to, Viagra was made as a blood pressure medication, and men had a hard-on, and now we're going into forget about it. It's just sexual wellness. So it's a similar type of effect for the BPC. Negative effects is you have to be careful who manufactures it, which peptide you're taking. You don't want to get into taking. There's a lot of these growth hormone analogs and other different types of growth hormones that work great. But you have to take caution because they can be problematic. You have to take caution on dosing. You have to take caution on where it's manufactured. Some people have reactions to the stuff that it's suspended in, how it's made. You have to watch it. Injection sites, you can have an anaphylactic shock. You got to be cautious with this stuff. I've heard of people injecting themselves and they end up in the hospital. Yeah, it's problematic. Versus cells, when you're doing cells, it's completely different. Cells are completely natural. Those are done under medical supervision. Peptides are sometimes they're not.
I feel like you can get peptides almost anywhere now.
Peptides are really cheap because they're cheap to manufacture, cheap to make. Each one of those vials that you're probably buying out there is probably $10, $20 a vial. that you're paying $100, $200, $300 for, whatever it is, because you manufacture in large bulk and they're cheap to make. Peptides are something that you're normally on regularly and you can cycle on and off. Cells, a lot of times you can be one and done, but a lot of times you require, depending on the disease. The peptides may help a little bit in a disease, but I got to tell you, peptides are not going to modify your immune system, reset your immune system to a younger state.
Okay, so they are different.
It's not good. They're different, yeah.
Any input on stem cell therapy for neuropathy? No other treatments have worked yet, this person says, this woman.
Yes, if for neuropathy they work phenomenal. We have to figure out what was the root cause, number one. I'm all about root cause. A lot of times neuropathies come from diabetes, very, very common, the most common cause. Other things can be injuries, spine injuries, normally some vascular issues. And if you think of how stem cells work, if we find directed where the neuropathy is coming from, we might be able to tackle it by doing a direct injection to the localized area. Neuropathy many times is basically a peripheral pain, and it's caused with the synapses of the central nervous system and the peripheral nervous system. The peripheral nervous system is your outside nervous system that's on the outside, and the central nervous system is the brain and spinal cord. There's a lack of communication or some form of injury or lack of the correct communication skills, or there can be a compression somewhere, or there can be a lack of vasculature. For any form of basically neuroregeneration, vascularization is required, meaning correct blood flow. Diabetes is the number one cause of neuropathic pain, eye issues, and kidney issues. They're all correlated, believe it or not, to vasculature.
And stem cells can help.
Stem cells can help.
Can it help MS symptoms?
Yes, it's an autoimmune disease, and it can help slow down the progress of it. The approach is a little bit different there, because in multiple sclerosis, which I've studied quite a bit on, I've published a paper on it, actually 2008, published a paper on it, and it can, because you're looking at, it's the bad thing about multiple sclerosis, it's like a dual-edged sword. It's two different diseases. One, it's an autoimmune disease, and it ends up being a central nervous system, so the brain and spinal cord injury. It causes wiping out of the conductance of electricity, a specific cell type called an oligodendrocyte. It's the one that helps wrap the electrical tape. It's like the electrical tape. It wipes it out. You end up having lesions, and you end up having issues. We need to look at each individual case, because there's different types of multiple sclerosis. There's primary progressive, secondary progressive, relapse remitting.
At least call.
I would say ask the question, let's analyze, let's dig deeper on. Number one is confirming. That's the other thing that we have a lot of issues with. Some people tell you I have ALS, which I was part of a group called ALS Heroes many, many years ago, and we started digging deep. They don't have ALS, but they might have a different type of neurodegenerative disease. Multiple sclerosis sometimes is also misdiagnosed. It might be some other type of autoimmune disease. We have to I'm all about, let's dig a little bit deeper. Let's try to find out. Let's confirm. Let's confirm that it's there. And if it is what it is and it's autoimmune in nature, I'm confident we can help.
Can stem cell injections truly help a herniated disc in the low back? We talked about back stuff, but what about that?
Yes, because number one is we talked about how do we strengthen. A lot of times when you have a herniated disc, what goes bad is the localized facets. The facets are on the outside of they're the shock absorbers on the side.
Right.
Those go bad too. And if I can strengthen that entire system around there, guess what? I get some relief of that herniation. Think of a little bubble that popped out, compresses on a nerve. If I strengthen that whole area, when I move the spine, it doesn't have that ability because it's so much stronger. It's not going to move as much. It's not going to be relaxed as much that you're going to have that pain. I might not be able to resolve the herniation. The herniation will be there, but I guess
you won't hurt.
Exactly. As long as if I tell you feel better, do you care if the herniation's there?
No.
Absolutely not.
No.
Correct. Yep.
So a lot of people go in and clip it, right? And what they do?
Well, they'll do either a laminectomy or discectomy, or they'll have to do a fusion if it's in really bad cases.
So at the same time, then, when you say strengthen everything around it, that also would involve some physical therapy as well, not just stem cells, right? So you want to
stem cells to strengthen the area, and you do want to get into core exercises
to work those muscles.
You want to go to physical therapy. Physical therapy is something that people take for granted and don't do it enough, especially when you have an injury. My number one thing is when I blew my shoulder out is I went to a physical therapist. And how long is this going to take? What do I need to do? Even though I know my workout routine.
Mm-hmm.
But it's funny how I learned that I was messing up on not warming up my shoulder before I was lifting, before I was doing shoulders. Now, religiously, before I lift, I warm up the shoulder well, make sure there's nothing wrong, and I progress into my lift.
Yeah, you got to warm up.
Yeah.
What ailments can it treat specifically? Stroke, CLD? You talk about CHF, but what else? I don't know.
Strokes are a vascular issue. It can treat strokes. It can treat, if the cell's the correct cell, it can treat practically any autoimmune disease, many autoimmune diseases. It can treat lung diseases because we've seen individuals that have polymyositis, dermatomyositis with lung involvement, ends up being a fibrotic lung, heal. I have evidence of this that we've actually seen. We have an individual that that went with pulmonary fibrosis, and she no longer has
it's
pulmonary
amazing.
fibrosis.
I talked to her the other day.
They told her she had like a year to live or 6 months, and we're talking about 3-4 years into it.
Yeah, it's unbelievable.
Yeah.
So is stem cell a cure for diabetes?
No.
Would it help plantar fasciitis?
Absolutely, yes.
Really?
Yes, absolutely. If done correctly, and if you have the right individual injecting it in the right spot, absolutely, yes.
That's in the feet, right?
Correct. Yep. And having the correct rehab, 100% yes.
Are those
because I've had that done.
So you get injections into your feet?
Correct.
Oh man,
it's painful. But you numb it first. I mean, and lidocaine's painful just to go in. So yes.
Have you done any of these treatments on yourself or your family? I know you've done it on yourself, obviously. What about your family?
Yes, pretty much all of them. My sister suffers from rheumatoid arthritis. She had to stop riding bike. She couldn't grip the bars. She rides bike. She does everything normal. My mom has this done regularly. She's got cardiovascular issues. She does this done regularly.
How does it fix or deal with cardiovascular issues? Oh, I mean, outside
increases blood flow.
Okay. All right.
Increases blood flow. A lot of family members. I have a cousin does this regularly, swears by it, especially for orthopedics. He's done a ton of this.
Yeah.
I've had plantar fasciitis. I've had this injected into my ankle. I completely tore my gastrocnemius, the calf muscle. I had it injected in there, healed it relatively quickly. I've had my sacroiliac joint, which I suffered from because of the surgery I had on my spine, affected. When you go lateral movement too much, you run too much, it's affected, or if you deadlift too much. I've had it injected into my sacroiliac joint, probably one of the most painful things I've had done. Had it injected to my shoulder. I've had it done systemically. I did an experiment on my knee that went bad that I had to fix, which I fixed. But it's I've had this. Yes.
What's coming in the next 5 to 10 years that would blow our minds?
You're gonna have approvals. You're gonna notice that these are gonna be therapeutic, and they're gonna be approvals on specific things with specific cells, not all stem cells, not all everything. You're going to have a lot of this is going to work in combination with other modalities. Mm-hmm. You're going to see a lot of things in mitochondrial health being focused on, which is coming around the pipeline, which is the powerhouse of the cell. I'm not big on these genetic modifications, these reprogramming. I think you're trying to play God. I'm not big on that. I think things are going to go away before they go good on that. I think that's further along. But in the next 5 years, if you're alive, you're going to be able to live a better, healthier life for probably another 20. I make a prediction that those that live now until 90 will probably live until they're 100, 110, 115, relatively good.
Did you go to that, what's that conference in Vegas, the A24?
A4M.
A4M.
American Academy for Anti-Aging. I've been faculty there. I redid their entire regenerative medicine platform in 2012.
I was supposed to go and I didn't go.
You didn't go, yeah.
I'm going to go this, if I can, I'm going to
go
this year.
The last 3 years, they've been focused on longevity.
Right.
It's a neat place if you want to buy anything or check out. You can spend all day in the exhibit hall going through everything and anything you can think of besides equipment, cosmetics, supplements, drug testing, anything. You'll be blown away.
But that's where you see the future of stuff, right?
Correct. It's a great conference.
Is there anything that's out there right now that's just BS that you think is like people are selling it and you're like,
I think a lot of these people that talk about, a lot of this reprogramming of cells by just taking a pill.
Oh yeah, I know.
I don't buy it. I don't buy it. I see what you have to do to just reprogram. Like one of the studies that came out it's actually an eye study that they're saying it's a longevity. It's not a longevity, it's an eye study. It's an eye study. And if you look at what you have to do to try to reprogram, you're going to be on doxycycline for 45 days, which is not even very tolerable for the individual for a week. There's a lot of, there's just a lot of stuff that people are pushing, like this fountain of youth.
Right.
The NAD was the fountain of youth for a long time. It sort of died down.
Do you believe in that, the NAD?
The NAD works great. It's not for everybody, because some people it causes palpitations, a bunch of other issues. Not for everybody. I don't tolerate it vascularly. I don't like the way it makes me feel. I can do the sub-Q injections, do it a little bit. I don't see much of a difference in me as an individual with it energetically. I'm already energized anyway. The NMN, which is now gone down a lot.
Yeah, that was something, because people were taking NMN before NAD or after NAD.
Correct.
Or something. Yeah,
and then a study came out that showed that it's nowhere near as effective as the NAD, and it was proven. And the problem is, you take pills and the stuff goes into your gut, and how much of it really gets into the system.
Right. What about all the teas and the drinks and the energy drinks and that? Do you believe in that?
I stay away from energy drinks. Teas are great. I promote the hell out of my colleague Josephine Musco's strips.
The elixir.
Yes.
Yeah, I've heard that's great.
Yeah, people don't understand that you're brewing a bag, that the bag is made out of plastic.
Right.
The tea's great, but you're melting plastic in your damn water, and then you're consuming it. And we are plagued. That's why people are getting sick with microplastics. Everything is in plastics. Mm-hmm. You got supplements. People are like, oh, I have the best supplements in a liquid form. And then you're pushing this stuff through, and the supplement is in a bag. It's in a baggie.
Is there anything that can get rid of the microplastics at all? I mean,
people talk about detoxing. I'm not 100% sure. I don't follow that.
TPE?
TPE, total plasma exchange. I'm not big on it, because I worry about the source of the albumin.
You freaked me out with that after I did it 3 times.
Well, the thing about it is that, so total plasma exchange, so the plasma is basically the proteins, everything that supports your entire cells in your blood flow.
Right.
And if you remove all of it, what do the cells have to do? They have to go on overload to try to produce it. When you do a total plasma exchange, you're substituting it for something else. Albumin is not the full answer. It works. It's one of the key components in there already. But you have to watch, ask the questions, where's the albumin from? It's going to be from other humans.
But if
it's from horse.
I did it, like, let's say 3 weeks ago. Am I okay now?
You'd be gone. That's out of your system.
Okay, right? So I'm normal now?
Yeah.
Because I thought it would help with the NK cells. And then I did EBU.
It helps clear your system.
What about EBU? You like EBU?
I like EBU. The only thing is that for some individuals, you have to watch the amount, which the practitioner knows how to use this the correct way, right? Because you are throwing in ozone that causes oxidative stress in the body, which sometimes can be good, but in minimal amounts. It's got to be done under correct supervision. It's got to be done the correct way. You got to talk to people that this has helped. Talk to the individuals that show you evidence on this, this type of thing, and how this helps.
Well, I just believe a lot of the people.
But it helps your blood.
But I'm literally a guy that, so-and-so did it, I'm in. I don't even research it. I'll do it. So I've done EBU 3 times.
I did EBU.
And then I went from EBU to TPE so that I could get NK, because I thought it would help my NK cells react better.
It's supposed to clear the slate. It's supposed to clear the slate.
So it would help. It would help NK cells do the job.
If you're an inflamed body, if you're in an issue, we talk about sometimes let's clear the slate a little bit so you're not that inflamed.
Right.
And then we can put something fresh in so it can last longer and it can live longer.
All right. Well, thanks, Rafael. Okay, so welcome to our podcast. This is a little bit different today because this podcast is a spin-off of our radio show.